Missouri Medicaid is getting a big boost, but how much will it cost? KCTV5's Leslie Aguilar is live now at St. Luke's Hospital on the plaza. And Leslie, there is still a lot to be figured out.
That's right. In fact, no one can say for sure just how much it's going to cost. It's now official. Missouri will be the 38th state to expand Medicaid, meaning an estimated 230,000 more Missourians will now qualify for the program. They are adults from 19 to 65, making $18,000 a year for individuals, and households of four, bringing in just over $36,000.
I think, statewide in both urban and rural areas, we're going to see the benefits not only in health outcomes, but in the economic boost, in the healthcare infrastructure, and, creating jobs and bringing that federal taxpayer dollars back home.
The Missouri Budget Project estimates Medicaid expansion will actually save the state up to $100 million. Right now, the federal government pays for 65% of Medicaid services in Missouri. Under the expansion, they will cover 90%. But a fiscal note prepared last year by the Missouri State Auditor's Office estimated a price tag of $200 million for Medicaid expansion.
We're incredibly concerned about it, and that really came from the fiscal note.
United for Missouri is a conservative policy group that has fought against expansion.
If we end up adding $200 million extra, and I say that tongue in cheek, of costs, where does that money come from? It's got to come from somewhere. Typically, the legislature and the governor, whether it be Democrat or Republican, has always had to go to public education or other areas to find extra money, if you will.
Dozens of organizations, from health nonprofits to charities and even the conservative-leaning Missouri Chamber of Commerce, support expansion, including St. Luke's Hospital, where uninsured patients often use the ER for primary care.
I think people with access to health care, people with the ability to seek treatment for all their health issues, access to medication, et cetera, I think that can only help improve health outcomes for the citizens.
Now, we told you about one, but there are actually several studies that indicate Missouri actually stands to save money with the expansion. But opponents point out that many of the groups that did these studies stand to profit from expansion. Opponents also point out that the state of New York is currently grappling with a $6 billion budget gap tied to Medicaid costs. Reporting live in Kansas City, Leslie Aguilar, KCTV5 News.
Thanks, Leslie.